Hi, I'm Scott Lang. Today is April 26th, 2020, which is into the 7th week now of the societal quarantine as a result of the COVID-19 coronavirus that is sweeping our country, this pandemic. And I just wanted to say a few words. First, we are now in the United States suffering over 54,000 deaths as a result of this pandemic. In Massachusetts, we are over 2,700 deaths. This is something that we haven't seen in our lifetimes. I think our grandparents or great-grandparents in the flu epidemic of 1918, 1919 saw something on this scale and beyond, but we certainly haven't. And we are in a situation now where we're basically relying on science, relying on our medical professionals, relying on the big pharmaceutical researchers, as well as the United States government and the entire world medical community to come up with treatments for the coronavirus that are effective, that prevent the type of deaths that we've seen, as well as a vaccine that we'll be able to get within a reasonable period of time that will inoculate us from this disease. We're also hoping that the antibodies that we would develop if we've had it will protect us and perhaps can be used not only for research for a vaccine, but also perhaps for direct infusion into people to help them build up strength in order to attack the virus. Now, this is an area clearly where 24 hours a day, 7 days a week, people who have this type of skill, expertise, and knowledge are working to, in essence, save lives. What I want to do, though, is say a few things. First, if we ever doubted how important first responders are, police, fire, and EMS, to our society, if we ever doubted how important the National Guard is, if we ever doubted how important our governments are on a local level, this shows clearly that we rely on them, we should thank them, respect them, and understand that there's strength in numbers, that we band together as communities in order to have resources to protect each other and our families. And that basically is what's on display here right now. Now, when you go a step further and you realize that this battle is being fought in the hospitals, in the emergency rooms, in the ICU units, on the hospital wards throughout this country, there is no one who needs to be thanked more than everyone involved in the medical care of our loved ones. So we're talking about everyone from our doctors, our nurses, our orderlies, the people who make the hospitals go on a day-to-day basis, and that could be the people who are providing medical care, from the people who are cleaning the hospital, that making sure that the supply chains, everything that needs to be done, is being done to keep our hospitals at full capacity that they have or that they're being built up to. So we want to give a tremendous thank you to all of them. They're putting their lives at risk. They're on the battlefield. You don't need to look any further than our local hospitals, whether it's St. Luke's or whether it's over at Toby or it's over at Charlton or at St. Anne's in Fall River, up in Morton, in Taunton. All of these hospitals are doing everything they possibly can to make our community a little safer, to care for the people who are sick. I want you to, whatever it is, say a prayer for them, please. Say a prayer for our first responders. Now, the other thing I want to talk about is what else right now is keeping our society, our country afloat. Clearly, if you look to see what's open. So if you start with our pharmacies, all the people that work at the pharmacies deserve a tremendous amount of credit. They're on the front line. Everyone who works in the grocery store, I don't care who it is, whether it's a kid who's packing or whether it's someone who's stocking shelves or the cashiers or the people behind the scenes, they all deserve a tremendous thank you. If our food supply went down, whether it's farmers, truckers, people who are involved in the production and the packaging of our food supply, our country would be in much different shape right now than it is. It would be much worse. So we need to thank them. We want to protect them. We want to keep them safe. And it's very, very important that we begin to realize we're all links in a chain. So in the past, and I just want to show you this, in the past, if you saw someone who was wearing a medical mask, you would think, or a mask of any kind, you would think that either they were sick or that they were involved in the healthcare industry. We all now have to wear masks. We all have to wear masks to protect other people from ourselves. The reason you're wearing a mask is not necessarily because it's going to protect you from being infected. The reason you're wearing a mask is because if you are infected, it's going to protect other people. So it's extremely important. The other thing is gloves. None of us wear gloves unless we're involved in an industry where we have to wear gloves. It's very, very seldom that you would wear gloves. But the fact of the matter is, in this case, you need to put gloves on. And that's something that is extremely, extremely important. This, again, protects you and it protects other people. If you're infected, the gloves will protect other people. If someone else is infected, if it comes on surfaces, it'll protect you. Social distancing. I know that we all think that this is reaching a point 7 weeks in where social distancing is getting to be something that is touching a nerve. But the fact is that we may have to social distance for a long time, and we should be doing it without even thinking twice. It'll save people in our family, people in our community, the elder people that we care so much about and are so susceptible. So I just wanted to say that this is the time where we band together. We band together, thousands and thousands of years ago to protect each other. We got to do it again now. The economy will come back. We will make sure that no one ends up in a situation where they are left so far behind that they can't even thinking of catching up again. The government programs, between unemployment, between the payroll protection program, between the different loans, they're trying to make sure that this economy will continue to stay stable and eventually start to grow again. And then last, our local leaders are doing as good a job as they possibly can under these circumstances to provide community services as well as keep us safe. Let's follow whatever they direct here, whether it's the mayor, whether it's the police chief, fire, EMS, whoever has specific regs or specific type of recommendations. Let's follow them. Let's try and dampen this thing, contain it, and move on, get that treatment and inoculation going, and see if we can't put this really bad chapter behind us and move forward. 2020 turns out to be an extremely challenging year. The 20s, it seems to me, if we can get this contained and move forward, still will be great years coming. So please be safe, stay healthy, and thank you very much for spending a few minutes listening to my thoughts. Thanks.